Greetings, friends and followers. This is Nurses Talking. I am Del Barzy. As always, if you like what you see and hear, subscribe, leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I have the very great pleasure of welcoming Dr. Teruko Williams out of California, yes, USA. Dr. Williams is a healthcare professional. She's a nurse leader with more than 20 years' experience. And she says that her career reflects a steady progression through the nursing profession. From certified nursing assistant all the way up to now, she is a doctor of nursing practice with a specialization in executive leadership. Over the years, she has developed broad experience in multiple areas of nursing. And she says that during the COVID pandemic, though, she experienced stress-induced anxiety, which profoundly shaped her professional perspective. And now she's an advocate for nurse wellness, encouraging professionals to prioritize themselves with the same dedication they extend to others. I love that.
Yes.
She recently expanded her work into the field of legal nurse consulting. So, welcome, 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 Dr. Williams.
Thank you, Dell. I'm glad to be here. I'm excited. Been looking forward to this. So excited. Glad that you provide this platform for nurses to share their stories. The unheard, untold,
Yes,
often not pretty stories. So thank you for this platform.
yes. Often not pretty, but needs to be said. If we're to get out of the, I think we have been for a while in a little bit of a funk.
Yes.
And if we're to get out of it, we're going to have to pull ourselves out of it. And one of the ways is to talk about it.
Yes.
Let's talk about the good, the bad, and the ugly of it
Talk about
all.
it all. Yes. Talk about it all.
So tell me though, what made you become a nurse?
I had a very, very vivid imagination as a child. I still have the same imagination, but then now you step into adulting, and then your imaginations are kind of, you don't know what you can do until somebody says, "No, you can't," right? So then
Yeah.
just close yourself in.
Mm-hmm.
But yeah, as
Mm-hmm.
a child, I will tell you, I mean, very young, like maybe 7, 8 years old. I don't know if you remember the little water babies. They were dolls that you put water in,
Yes.
supposed to mimic an actual, real life baby.
Yes. Yes.
So my mom is a baker. She still is a baker to this day, right? So she would have like food coloring sitting around. And unfortunately, at early on, she was diagnosed as a diabetic. So she had insulin needles. No need for a little child to be playing with that, but I found one. I found when I snuck one of her needles, and I was gonna perform surgery on this baby.
Yeah.
So what I did was I put the water in there, of course. I put the food coloring in there, the red food coloring to make, blood. I had
Mhm.
a popsicle stick. I cut the arm of of the doll, and I inserted the popsicle stick into the arm. And then I just ran in and I was like, "Oh, we got emergency surgery." I'm not even sure what I was watching to even know this.
Mhm.
But yeah, I was gonna perform surgery. She can also sew. I took some of her needle and thread. I performed surgery on this doll. I stitched her back up. It was just a whole spiel. I had a towel, everything ready to go, and I saved that baby's life. That baby was a brand new baby after that. And then it's interesting, it kind of transitioned on into I moved to math teacher. And I did not like math. And I still don't like math much, right? So I went into wanted to be a lawyer, and that kind of stemmed from my father. He wanted to be a lawyer. He was involved with criminal justice. And then somewhere along the line, my father was diagnosed with cancer, unfortunately. And I remember taking him back and forth to his chemo appointments. And I
Yeah.
remember looking at all of the nurse practitioners, the doctors, and all of this stuff. And I'm just the way they cared for my father. And then I was like, nobody can care for my dad like I can. So I was like determined to just be this nurse at this point. And that from maybe 14, 15 on until now, I was like, I'm determined to be this nurse. And it has just shaped my life ever since then. And I literally kept that whole nobody can take care of my father like I can. When he got a little more sick, I moved and took care of him. I was like, no, nobody can take care of my dad. And it was a personal thing. And then I also felt like, maybe I should advance these skills of mine. And then
Yeah.
we're here today.
That's how it went. That's how it went. But in your in your bio, say you started as a nursing assistant and now you've gone all the way through the steps. Along the way, what would you say challenged you the most?
Um, let's see. So I was a CNA in high school. About 17 years old. And I was determined not to work at the movies because all of my friends wanted to work at the movies. Like, I don't want to work at the movies. I want to go right into it. And I
Mhm.
kind of found the certified nursing assistant class. And I was like, let me just take this. And then I moved to LVN. And I think the most challenging part was that becoming an LVN and the lack of respect for that
Mm.
particular
Yes.
nursing skill, right?
Mhm. Mhm.
And I faced a lot of just negativity for the most part because it was always you're a glorified CNA, or you can't do certain things, and then are you a
Mhm.
real nurse? LVNs are not real nurses. You're not a real.
Mhm. Mhm.
And it's like, yes, I am. What do you mean that licensed vocational nursing? That's a nurse. I'm a licensed nurse, and I think that was probably the most challenging part. Um, But the LVN is where I learned most of my skills. I
Uh-huh.
learned more skills as an LVN than as an RN, and I'm, not afraid to admit that. I had no issues going from LVN to BSN. The respect, I guess it just magnified then. It's like, oh yeah, you're a nurse, you're a real nurse
Mhm.
now.
Yeah. Mhm.
Uh, you're on this side. Um, and then I think it was almost like in certain areas of nursing, it's almost like it's it's like a clique or a sisterhood of, it's RNs against
Oh yeah.
LVN. And
Yeah.
then I
Mhm.
found myself like, no, I was an LVN. I know probably know exactly what she's going through, right? I'm not going to join in with you guys. So that was a challenge, right? Making sure I stayed true to, hey, I know where I started. And no, I won't put my LVNs to the side. I'm going to reach in and help when they need it. Um, and then I think another challenging moment came when I decided to get my doctorate. I did not want that. I had no plan, no thought, nothing. I was like, Doc, somebody told me I was going to do it. And I was like, no, I'm not. Oh, absolutely not. I will not.
Mhm.
Um, and I think that part, the challenging part from there came from when I had to, it was my job at the time not willing to work with me to help me advance my education. So, out of all of those challenges, I would say the worst part of that was probably the job not supporting me to advance my education. That was the biggest
Mhm.
challenge.
Mhm. 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 It's I can see that too. I can see, I know that that happens a lot, and I'm not sure what the mentality is that creates that block along the system. It's
Yeah.
almost as if somebody feels, well, if you advance A, you're going to be maybe equal or more than, and we can't have
It's
that.
funny that you say that, but even just to elaborate on that part, that's exactly how I felt.
Yeah.
I had just graduated with my master's when I had started this particular position, and there was no issue. I got cards, I got wow, congratulations, and kudos to you, and girl power, yay, you. And then as soon as I got accepted into DNP, it was like, well, how's this going to affect your hours? Where are you going to do your clinicals? Need I remind you, I'm at a hospital system, so I'm like, I'm gonna do them here. And they didn't want to pay for it. They was like, well, we've never paid for a doctorate before, so we're not prepared to do so now. So they denied me tuition reimbursement. They denied me scholarships. They denied time off. They made it so difficult for me. But just I'm also a praying woman, and I believe what God has for me is for me. I ended up getting a scholarship that paid for it, and I have no debt from my doctorate.
And you have no
So,
no
so hey,
debt,
it
no
worked out.
obligation to anyone else. I saw you say to them, thank you so much.
Thank
You have
you.
no objections.
Thank you. Thank you guys so much for that.
I've lived long enough to understand that so very often when people stand in your way, deliberately or not, they're actually helping you.
Not
You
even
don't know it
knowing
at
it.
the time, and they don't know it, and it turns out that they were helping you.
You were boosting me. You were that stepping stool that I needed, that I
Yes,
didn't know that I needed.
but I
Uh,
needed
but it gave me just enough drive to just say, hey, I'm gonna work through it. I'm gonna
it.
work through it. You don't turn down a scholarship. You know, you don't education is this is free. You don't turn that down, so we're
You
gonna make
don't
it work.
say, yeah, exactly, exactly. So you've worked a lot across many different areas.
Yeah. Yes.
And well, let me start with this. In all of those areas, what gave you the most satisfaction? What grabbed you the most?
Hmm. Ooh, that's a hard question, Dale. Oh, came out swinging with the quick. No. Oh, I just wow. I've never thought about that. Ooh. Actually, I would say maybe two areas. One area was home health.
Mm,
That one definitely gave me a lot of kind of, I would say, just it was a humbling experience because, once individuals are in hospitals or in rehab or, you're at the bedside, you don't get to see how they
yeah,
got here at times, right?
yeah,
You don't know their home situation, and as nurses, you have this kind of this one track idea of I gotta take care of this patient to get them out of
yeah.
this bed and home.
And
But then
home
what does home look like?
is home. Yes.
What is home? So to go to the homes of people and sometimes I would be at hotels. I would be at extended stay places. I would be at individuals living with family because they unfortunately may have gotten put out of their home because this injury has caused them to lose a lot or this disability has caused them. So kind of getting there and being able to advocate for them on the back end, like, wow, this you can't do certain things because you
Yeah.
don't have transportation. Right? So sometimes you can't keep your appointments. You don't have a
Yeah.
job, and I think just being able to kind of advocate and kind of push and give encouragement, and letting them know that somebody is in your corner, that brought me a lot of, just satisfaction. And for a minute in between there, I did lose a little bit of that. I'm originally from Texas. So when I left Texas, I was doing kind of utilization review and then kind of service coordination.
Yeah.
And then I kind of stepped into it here. So in that transition, I kind of lost it a little bit. I loved utilization review, but there was still just a part that over time just kind of felt missing. So now I'm in correctional health as well as legal nursing, and we run this program to help the incarcerated individuals. And I feel that spark again because I literally get to talk to them and get to hear their story. Like just for a moment, I'm not going to judge you for being here. I don't even want to know why you're here. We don't even have to discuss why you're here. Right now, you're in my program. Let's talk about how we can advance you while you're in this program. And then when you leave, you won't come back. You'll be a better you. And I just kind of found that spark again. So right now I can say that I feel a sense of satisfaction with doing that. And stepping into this new role of legal nursing. Um, I don't know. I don't know, it's like a challenge. And it's different. And
Mhm.
to hear the lawyers kind of tell me, I hate this. I don't like anything with nursing. I hate medical. I hate chasing down medical records and I such and such. And I'm like, ooh, I can help you with that though.
Gotcha.
I can solve this problem for you. Hey, let's work together. So I feel a sense of, satisfaction kind of coming back a little bit. But yeah, for a minute there, I did kind of lose it. And I think like most nurses, you do kind of get in the hustle bustle, the
Yeah.
day-to-day task, and you do kind of I'm just I'm surviving, not thriving.
Yeah. Yeah. Yeah, yes, 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 yes. I get it. And I get the idea of moving on to because when I get to the place where I kind of feel like, almost I can almost do this with a rote,
Yeah.
I have to move.
Yeah.
I know. I get so restless.
Yes. It's
So I
crazy how
get
we get
that.
in those modes.
Mhm.
It's like it comes with the territory. I
Yeah,
want to believe that every nurse who has been a nurse more than 5 to 10 years has probably experienced that feeling.
yeah, yeah, yeah. I get that. I get that as well. What do you think, though, over all this time you've over 20 years now.
Mhm.
I have seen a lot of change in nursing over the course of my own career, which has been, more than twice as long as yours.
Oh no, 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 Dale. I don't believe that. Oh no.
Oh dear. But what do you think you'd like to see change?
Ooh. Oh, oh my God, okay.
Hmm.
Policies, respect for nursing and what we do in general. And what I mean by that is that I'm in California. Like I said, I grew up in Texas. I did not see this too much in Texas. Nurses striking for pay and better
Uh,
working conditions. I don't recall seeing that a lot. Since I've been here, though, it has been all the time. Like it's like every year there's another strike for better pay, for better situation, for better conditions, for safe patient to nurse ratio.
just a bit.
Yeah, nurse to patient ratio. And I think I want to just see better policies around um how we keep our nurses. There's a word I'm looking for, it's kind of escaping me right now. But when you're hiring and they don't leave, retention, nurse retention.
Return.
I want to see
Hmm.
better policies around nurse retention. How do we keep our individuals? How do we train them? We kind of get our nurses in the door and we just, okay, go. They may get 2 weeks of, training and then it's like, okay, go. And then that
Yeah,
2 weeks is it's not really a teaching or
it's not
mentorship.
real.
Right. It's just kind of all right, look what I'm doing. Just make sure you don't mess up, protect your license, and okay, you're good. But what does that mean? What does protect your not license mean? What does the documentation look like? What does it really mean? And then you have nurses that are now leaving within 3 to 5 years of
Yeah.
starting. So
Hmm.
if our nurse retention is low, who's going to take care of the next generation of nurses and next generation of people? And it kind of scares me because yes, I'm younger. You know what I mean? Dale, you do look amazing, by the way. Now, I was really, really like you look amazing, by the way. So
Oh, thank you.
I was being serious. I was being serious. But even with you, when you think about 10, 20 years from now, we don't know what life is going to look like. And now I got to trust that what has been taught to these nurses is going to be able to sustain me if I need it. And for the first time in a while, I'm scared. I'm not gonna lie. I that's one thing that I would like, a better training. Um, what does that look like? I think right now, even in our education, I don't want to say we're pushing nurses through. I just want to say they're not getting the full
Yeah,
hands-on experience. And
I
then we
know.
don't pay our nurse educators a lot either,
I know.
right?
I know.
Um, So I would like to see changes in that. Our nurse education, how we, train our nurses, why do we do the things we do to tell them to critically think, what is your next step?
That's the
Um,
next step. Yeah. Yeah.
yeah, I would say nursing retention and training. That's probably
Hmm.
what I would want to see the most because I am nervous about it. I'm not gonna lie to you.
I get you. I am also I can be nervous about it, and I not for nothing. I think I have started to look at this in a very kind of selfish way, and I said, well, listen, you guys, inspire me to stay well because I can,
Hmm. Hmm.
you
Yes.
know. But and that is not to say that nurses are in general not and now my word escapes me. I'm saying efficient, but efficient is not the word I really
Mhm.
want. Capable, perhaps, or even more so. I would think that the great majority of people who are in this profession really still want to do it and want to do it well. However, as you mentioned, especially as COVID came along and people had to shift the way nurses were educated and all of that. And I don't think we've done a full shift back.
No.
It leaves some gaps.
I think there are some big gaps
It
in
leaves
there.
some gaps.
I think just yeah, I think when COVID hit, you mentioned that. I think when COVID hit, I think there was a light, a big spotlight that hit nursing
Yeah.
and what we actually do. You know what I mean? There's such a
Yes.
grand we do a lot. We're not just nursing. You go to school for nursing, but when you get to the bedside, when you get to the individual's home or however utilization review, even legal nurse consultant, you put on many hats. You're really the
Everybody.
counselor. Yeah, you're the dietitian, you're the investigator, you become the advocate, and then I have to take care of you. And there's
Yeah.
a lot of things that go on. And then after I do that, I have to fit time in to take care of me.
Yeah.
Where do I fit in this, right? You need someone to take care of. If I don't take care of me, I can't take care of you. And then now we got two patients in the bed.
Yeah.
And there was
Yeah.
only
Yeah.
supposed to be one. So,
Yeah. And we've been kind of conditioned to just not put ourselves in the equation, quite honestly. you
facts.
know. So we've kind of been like that. But as you say, where everybody, and that's one of the reasons one of the reasons or one of the goals of this channel actually is that I really, really want people we serve to see us differently because they
Yeah.
see us completing tasks but they have no idea what we bring to this task. And if we don't tell them, they're never going to know. And if they don't know, we can complain until we're blue in the face that we're unappreciated.
You said it. They really do think that we sit behind the desk and just check off what we need. And it's like,
Yeah.
no, 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 no. That's a portion of it. You don't see me lifting, these patients. I'm 5'1",
Mhm.
barely. I'm 5'1", and I might have to lift a man that's 350 pounds, 6'5" in a bed, right? Because he can't move. We
Yeah.
may or may not have help. You don't see that. You don't see our backs, being strained. You don't see our knees. You don't see the fighting that goes on. You don't see I hate to even bring it up, but you don't see the bias and sometimes
Yeah.
the
Yeah.
discrimination
Yeah.
that goes on behind the scenes of I don't want you as my nurse. And it's like I
Yeah.
just want to take care of you and do my job.
Yeah.
Uh, they don't see the nurses who have been hit, nurses who have been unfortunately unalived, uh,
Yeah. Yeah.
nurses that have these mental issues now
Yeah.
because there's a whole back end that people don't see. They just look at us at the bedside
Yeah.
and we're
Yeah.
basically their servants of today.
Yeah.
That's what it feels like at times. You're my
Yeah.
servant and you do what I tell you to do.
Yeah. 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 Regardless of the fact that what you want me to do is ain't gonna serve you right now. Okay.
Right. Right. Mm-mm.
Oh dear. Well, so here's the thing. I wanted to ask you also,
Okay.
what was it about correctional nursing that drew you? Because it's something I know. You do two things that I know I cannot do. I lasted in home care for one day. One day. And corrections, not because of the the people in the institution, but because I can't stand the sound of those doors closing, I just can't.
Mm. Okay, I understand, and that does play uh a role in some other things. Maybe we'll get to that later. So, um, it was really the program that drew me to it. And I don't know how much detail I can actually give
Hmm.
around it, but I will say, um, it was it was a program that really drew me to it. So the program basically is kind of centered around mental health, and they run the program through our nursing department because of the components of it. And
Hmm.
the idea is when the individual leaves, they will have enough training from our program that they can become certified in the community and they can find jobs.
Okay.
Um, so although I'm not inside the prisons 9 to 5 every day, I'm not there. We do visit. I work basically for the corporate office of the prisons. So we do visit, we teach our program. They go through our program for about I think fully from start to finish is about eight or so weeks. We give them kind of on the job training. We teach them a different, set of skills. They use them inside the prison. And the idea is while you're here, you're going to use these set of skills that we have taught you to help your brother or your sister. And like we have individuals to use their lived experiences. So if you've had issues with substance use before, but now you're clean, you're sober, you're going to utilize these skills that we're teaching you so that you can help another individual that may not be sober. Just because people are in prison does not mean they're sober. They figure out all
Right.
kinds of ways to get things in, just so everybody knows. There are ways to sneak things in,
Right.
right? And so they may or may and they make their own things, right?
Mm.
So the idea is you're going through this journey, you're using your lived experiences. We're going to help you to kind of cultivate these skills. You're going to use those skills to help somebody else kind of get through their journey. And a lot of individuals that come through our program, they're within about 18 months of releasing. So once you release, you can take a test, like I said, an exam, become certified in this particular field, and then find jobs. And we have had individuals that have come back and told us, hey, they found jobs. And the other idea is to reduce recidivism. We don't want you to
Uh-huh.
come back. We're trying to remove one obstacle for you, and a lot of times that is finding suitable employment, right? You're
Hmm.
coming out,
Hmm.
you may have felony, you may have a bad
Yeah.
background. This doesn't matter. Our program, it doesn't matter if you do have a felony. It doesn't matter what your background is. So we've kind of tried to eliminate all of that to at least get you a good job when you get out there. And that's what I meant earlier when I'm saying I felt like I have a spark again. That because it's rewarding to me to
Yeah.
know that I can help you. You
Yeah.
know,
Yeah.
whatever you do when you leave is on you, but at least you
Yeah.
had somebody on this end. You've been beat up enough. Let me try to find a way to help you so you do not come back in here because I don't want to see you back in here. And
Yeah.
that,
Understood. Understood. I love that. I love that. What advice would you give somebody who wants to be a nurse? You've gone the whole length of it. So what advice do you have?
oh, one, because I do get asked, this question. I get asked from, individuals who are either just now trying to get into it, or maybe they're as a CNA or something like that. Um, my advice is to, first of all, never lose yourself. And always remember that you have options. I've talked to individuals who, they feel like they're stuck at the bedside. They don't like the way they're being treated, right? Or maybe they're doing L&D, maybe they're doing OB, and they're like, well, this is all I know. And it's like, well, you can do other things, you can do telemetry if you want, just find other areas. And then I have some that just say, I don't want to do bedside at all. Okay, well, you have case management, you got utilization review. Even what I'm doing is a form of nursing, but not fully, right? Now doing legal nurse consulting.
Yeah.
Uh, you can do education. You can be a school nurse. Yes, and I'm like, we need you, please, please go into education. We need you. So just never
Yes.
lose yourself and know that you have options. And always remember that, nobody's ever going to pay you for what you're worth. You you will never be paid. You will never be, receive your full respect. And I have to say that part because I think when we go through nursing school, you hear that good, positive push, like you're going to be wonderful, you're going to be great, and then you get out there and you're being bullied by other nurses. So I like to have these real conversations with them, like, hey, there are going to be times where you may not have help on the floor. There are going to be times where you may not get to take your restroom break. There are going
Yeah.
to be times where you may have to eat without, uh,
Yeah.
uh, go your whole
Go
shift without.
without eating.
Yes, there may be times where you don't get your break. There may be times where, the family is going to accuse you of everything, which way, shape, form, or fashion, and the patient has nothing to say about it. There are going to be times, but you have to remember who you are and you have to remember your boundaries. How far are you willing to go? What are
Yeah.
you willing to allow?
Yeah.
And remember who you are. It is good. It's rewarding. It for sure is. I would never say that it's not. It for sure is. And I
Yeah.
have no regrets of
Yeah.
taking this path. But I cannot uh promote it without giving the full story here. We got to be
Yeah.
honest.
Yeah, yeah, exactly, exactly. Because in no way, shape, or form is it an easy path. And if you're
Mhm.
not honest with people, that's the first that's the first step in the breakdown.
Yes.
You know? Because even if you're honest with people, if they hear that, even when they come in excited and then something happens, somewhere in the back of their mind, it's like, I heard this before.
Hmm. Hmm.
I never heard it.
And you got to pull from that area. You have to pull
Yes,
from
you
this
have to
bag.
pull from that. Yeah,
You got to pull from it. And when it's just like anything else in life. Somebody has told you all of the great things of life, and then, you get out there and start adulting. It's like, whoa,
yes.
what is this? Where did this come from? Wait, hold on. Somebody told me a fairy tale because that's not what it is. And I
Yeah,
try to be honest with individuals that come to me and ask me, like, okay, yeah, I also want you to see the dark side of nursing.
yeah,
I want
yeah,
you to see that management doesn't always have your back. I want you to see all of that. And you are your best advocate. You know your boundaries.
yeah,
Remember who you are and don't lose yourself
yeah.
in the process or the journey.
All the journey, right? And
Mhm.
it's one of those, up and down, exciting journeys.
Mhm.
What do you do to care for you?
Ooh. So I'm starting to get a little bit. Don't you laugh at me, Tail. I'm starting to get a little bit better about caring for myself a little bit better. I do go and get massages. Um, right now, I've kind of created my own little kind of Hawaii kind of theme, right?
Thing?
You see, I got
Yeah,
the wind kind of blowing on the leaves a little bit. So, like, I kind of created
yeah,
my own little background.
yeah.
Um, I would say I was one to just kind of go, go, go. My love language is acts of service. I love doing for people.
Yeah,
I like helping.
yeah,
And during COVID, when I started experiencing this whole stress-induced anxiety, I had I had never been in this space before. It was extremely dark for me. And I'm a lead to how I started caring for myself. Um, I started experiencing all of these just different symptoms. Like, I would have like numbness and tingling in my hands.
uh-huh.
Um, my vision at times would just kind of like I would see flashes of lights. I would get headaches out of nowhere. I don't have migraines. Thank God I don't suffer from it. Um, I started having these heart palpitations. I would wake up in the middle of the night feeling like I couldn't breathe. I would be gasping for air. And it's like they kept getting progressively worse and worse and worse, to the point there was moments that I couldn't even stand up. And I like to cook, and I couldn't stand in the kitchen for longer than like 10 minutes. I had to sit down, my feet would start hurting. My digestive system was off. I had no appetite. I wasn't eating. I would wake my husband up in the middle of the night. I could, oh my God. Thank God you have a partner that would go through it with you, because I know I got
Yeah.
on his nerves several times, but it would be 3, 4, 5 in the morning, and I'm like, honey, we got to go to the ER. I think I went to the ER well over 20 something times. Well over 20 something times in a 2-year span. I had all kinds of specialists because everybody was trying to figure out what was going on with me. I had a
What's going
neurologist,
on? Yeah.
I had a cardiologist, I had a heart monitor, I had a gastroenterologist, I had a rheumatologist. In my regular PCP, everybody was like, we can't find anything wrong with you. We can't, like, that would be contributing to these symptoms.
Yeah.
And finally, my doctor was like, I think you're stressed. I think you're stressed. And I said, no, I'm not.
No,
No,
I'm not. Yeah, I
no.
know.
Yes. you know. I said, no, I'm not. And he said, no, I think you need to think
You
about this.
were.
Yeah. And he said, I want to take you off of work. I said, no, you will not. You will not take me off work. Now, I'm also going in every day, deathly afraid of COVID because nobody knew what COVID was. And I had to
Yes.
go in every single day. And I was like, oh my God, I don't want to get it. I'm terrified. And that's what was contributing to it because I was so scared about that. And I never stopped for just one moment and said, calm down, deep breathe, whatever. Eventually, I said, okay, fine. I was sitting on my computer and I just started seeing flashes of lights and I was like, something's wrong, something's going on. And my doctor was like, are you gonna listen to me now? And I told him, yeah, I will. I will. So then I started taking these stress classes where you can become certified in stress management. Even as a nurse, you don't know everything. And even these same symptoms that I could help somebody else with, they kind of they worked against me because I
No.
knew what they meant. I knew what like tachycardia meant. I knew what numbness and tingling meant. I knew what all of this stuff meant. And I'm like, oh my God, I'm dying. And it's like, no, you're not dying. And I had to go through those classes and I learned more about how the brain works. I learned more about, the different types of hormones like cortisol, adrenaline. I learned more about dopamine. I learned more about just how your neurons they fire off when you're overly stressed and
Mm-hmm.
how just I learned about all of that. And then it got to me where I started taking those deep breaths. I started getting ahead of those thoughts. I went to therapy because I really didn't know what was going on with me.
Mm-hmm.
I was like, you
Mm-hmm.
got to figure this out because I didn't want anybody at my funeral saying, "Oh, she was a wonderful person."
Mm-hmm.
I didn't want that. I was like, you got to figure this out. And that's when I realized, oh my God, I'm scared of COVID. I'm scared of dying. That's where it was coming from. I was scared. I was scared of that. And that's when I said, you got to do something because it's affecting your life, it's affecting your quality. Um, and I started doing more self-care, taking baths, uh, longer baths,
Yeah.
um, spending more time, just prepping myself in the morning. And I've fallen off a little bit, but I come back. I do stretches. I stretch a lot, because I learned how the body holds, the tension in your muscles. So that's kind of how I try to care, and I try to remember. I never want to go back to that place. I never want to go back to that emotion, those feelings, those ER visits, the blood draws, oh, the needles, oh, the scans, the MRIs. I don't want to go back to that. So in order for you to work, you have to take care of yourself. And I have to
Yeah.
keep that at the forefront.
Yeah.
I take
Yeah.
breaks when I need to. Of course, I pray. And, sometimes I'm like, I'm not doing nothing today. I'm just going to sit on my balcony
Yeah.
and just feel the wind. And
Yeah.
that's my self-care.
And right, I was going to say, and that's important. That's, caring for you. That's what you need. And I maintain I've learned that, really, for me, actually, there's some things I do, but for me, the most important thing I can do is just listen. 'Cause my body's talking.
Yes.
But what's your listening and paying attention? the rest comes, not necessarily easily, but the rest comes.
Hmm.
You can do the rest of it.
You're
You
absolutely
can
right.
do the rest of it. Yeah. What do you say? I have one last question because I started a while ago. I started collecting words. I kind of dropped off it, but what would you say if someone were to ask you, what do you think of as the most essential quality of a nurse? What would that word be?
Mm.
In one word, what would that word be?
Well, maybe self-motivated, maybe a
That's
self-starter,
most.
self-motivated. And I say that because you're not gonna always have the answers right in front of you. You're not gonna always have the help right in front of you, as I, stated earlier. You're
Yeah.
not gonna always have anything right in front of you. And what you've learned in school, when you're here, you're looking at this patient that has a blood pressure of, 130 over 85, and you're thinking, oh, that's high blood pressure because in school it's 120 over 80. May be normal for them. That may be their
No.
baseline, right?
Yes.
So just, being self-motivated, again, starting with you and just, reminding yourself, I can do this. I just got to get started. I can do this.
I can do this. I can do this. Yeah. Self-motivated, that's a good one. That's a good one. And one of these days, I'm going to put all these words into it. I'm going to nurse. All of these words that we
Right.
because we are so not nothing, but we're so many things that sometimes we don't even realize. No, we just start to take it in stride, and it's like just normal. And it occurs to me, not everybody can do this. It might look
It's
easy to some people, but not everybody can do this. It
harder than
requires
what you think.
something special, and what that special thing is, I think we need to identify it. It's not the same in every one of us.
You're
But
right. You're right.
so that's why I'm asking those questions.
That was a good question. That was a good question. Makes you think a little bit. Good question.
Yeah. Well, thank you so much for this
Thank you.
conversation. It has been a joy. I truly have enjoyed it. Thank you so very much.
Oh, thank you so much, Dale. And again, I thank you so much for, just providing the space for individuals. And I pray your platform grows, that, it just reaches individuals and people can actually hear the stories that we go through. So thank you for shining light on
And thank you for saying that. I appreciate it because it's what I want to do.
that.